Wheezing means you potentially have a serious lung problem. Wheezing is the noise produced by air as it is forced through narrowed air passages in the lung when you breathe out. Narrowing of the air passages may suddenly occur due to a squeezing of the muscles or bronchospasm in the wall of the small airways. This produces asthma, and it may be the result of an allergic reaction, an inhaled irritant, or a reaction to medicines, stress, and inhaling cold air. Asthma attacks can be severe and life-threatening. Even if your wheezing has been only mild, you could have an attack so severe that you would not be able to breathe. Therefore, if you wheeze, you should be evaluated for asthma. The treatment includes sprays and pills that can relax the muscles in the walls of the airways. Emphysema can also cause wheezing by destroying lung tissue, which results in narrowed air passages in the lungs. In emphysema, there are also pockets of dead air space in the lungs due to destruction of the tiny air sacs. This stale air takes up space in the lungs, limiting the amount of fresh air you can breathe in. Therefore, you don't get enough oxygen in your blood. If the disease progresses, it can be fatal. Tumors in the lung can also block air passages and cause wheezing. Smoking can destroy your lungs by worsening asthma and causing emphysema and tumors. If you smoke, stop. Consult your doctor for assistance. If you wheeze, it is important that you are medically evaluated as soon as possible to determine the cause and appropriate therapy.